Hello everyone. Today we'll talk about postpartum hemorrhage or PPH. Is a life-threatening complication. Globally, it claims the lives of 140,000 women annually. That is one death every 4 minutes. Most of these deaths occur within 24 hours of delivery. Beyond fatalities, PPH can result in severe complications such as respiratory distress, coagulopathy, and even infertility due to pituitary necrosis, which is known as Sheehan syndrome. PPH is relatively common, occurring in about 4% of deliveries. Traditionally, it is defined by blood loss of 500 milliliter for vaginal deliveries and 1000 milliliter for cesarean births. However, the ACOG now recommends defining PPH as cumulative blood loss of 1000 milliliter or more, or the presence of hypovolemic symptoms within the 24 hours, regardless of the delivery mode. Estimating blood loss can be highly subjective and its impact differs based on the patient's weight and pregnancy type. For example, a 50 kg mother with triplets may experience severe symptoms with less blood loss compared to a 75 kg mother. This is why objective measures like hematocrit drop, need for transfusion, or clinical signs of hypovolemia are crucial for diagnosis. There are two types of PPH. Primary, which occurs within the first 24 hours, is more common and poses greater risks. Secondary PPH happens later between 24 hours and up to 12 weeks after delivery and tends to be less serious. Risk factors. We have various risk factors increase the likelihood of PPH, such as prolonged or rapid labor, a history of PPH and preeclampsia, uterine overdistension, often seen with large babies or multiple pregnancies, also heightens risk. Other contributors include operative delivery, operative delivery and infection like chorioamnionitis. Early detection of PPH is vital. Blood loss of 10% may show no symptoms, but as it progresses to 15 to 20%, warning signs like increased heart and breathing rates appear. Beyond 30% loss, hypotension sets in, and above 40% can lead to shock, coma, and even death. The leading cause of PPH is uterine atony, which is frequently asked in questions, and the uterus fails to contract effectively, accounting for 80% of cases. Other causes include retained placental tissue, genital injuries, and coagulation disorders. We remember them with 4T like atony, the placental tissue, the thromboembolism disorders, and genital tract injuries. Okay, for the lecture that how we will manage PPH, I will talk in the next part. But generally, timely management is key to saving lives. Identifying the source of bleeding and acting immediately can significantly reduce complications and mortality. Awareness of risk factors and preventive strategies are crucial for better outcomes.